students from the Foundation of Agricultural Science Studies, UPM, and we would like to thank you and welcome you for tuning in into our podcast today, where we geek out on all things science. So today, we will be learning about the tiny but mighty amino acids. I'm Sarah Adriana.
And I'm Hidana. For those just tuning in or meeting this molecular rock star for the first time, amino acids are the 20 essential building blocks of life. They don't just create proteins, they are out here sending brain signals, healing wounds, and yes, even fueling your gym gains like tiny biochemical ninjas.
Yeah, so without them, you'd be a pile of, well, mush. So today, we will be uncovering how medicine hijacks these ninja molecules to fight diseases, boost recovery, and also even hack your mood. With our incredible guest, Mr. Azaruddin Bin Azis, the Deputy Director of the Pharmacy Enforcement Division from the Ministry of Health Malaysia, who speaks fluent amino acid. On behalf of our faculty, we would like to thank you, Mr. Azaruddin, for coming and agreeing to be our guest tonight. Besides that, we also have very curious amigos who have questions themselves. Allow me to introduce Dania, Christina, and Nazura.
Alright, without further ado, let's dive into today's episode. It's going to be amazing.
You're certainly right, Hidana. It's going to be amazing. So, kita start from the beginning, Mr. Azaruddin. Can you walk us through your day-to-day work? What first drew you to be in this field?
Assalamualaikum and a very good evening to everyone. I'm Mohd Azaruddin Bin Azis as a Deputy Director of Pharmacy Enforcement Division. So I have worked at a government service since 2001. It's about 23 years in public service. First at Hospital Kuala Lumpur, and then I work at Jabatan Kesihatan Negeri, Wilayah Kuala Lumpur, and also at Melaka. And right now I work at Pharmacy Enforcement Division at HQ headquarters of KKM, Ministry of Health, Kementerian Kesihatan Malaysia, Ministry of Health. Okay, so we go to your question, the first question. So today I would like to share about the job scope of pharmacists in Malaysian public service, especially under the Ministry of Health. Right, first and foremost, pharmacists play a vital roles in ensuring the safe, effective, and rational use of medicines. We can find them in various sectors such as hospital, health clinic, enforcement division, regulatory agencies, and administrative office. Let's start with hospital pharmacists. Okay, in hospital, pharmacists are responsible for dispensing medication, counseling patient, monitoring drug therapy. We also participate in clinical ward round together with doctor and nurses, offering valuable input on medication choice. Some hospital pharmacists are involved in preparing sterile products such as intravenous drips and total parenteral nutrition. They also handle inventory management, making sure the pharmacy is well stocked with essential medicine. On healthcare or clinic kesihatan, pharmacists play a more community-focused role. We manage medication, therapy at current clinic or MTECs, where we help patients manage chronic disease like diabetes, hypertension, and asthma. We also provide counseling and health education to ensure patients take their medication correctly. Of course, we also handle the supply and stock of medicine at the clinic level. In the enforcement division, in my division, we enforce law such as Poison Act 1952 and Dangerous Drug Act 1952. We inspecting premises, investigating illegal drug sales, and even working with custom officer. Police officer, unregistered or counterfeit products or drugs. And some of us stationed at a National Pharmaceutical Regulatory Agency, we also call it as NPRA, where we involved in evaluating and registering medicines, including traditional products, supplements, and also traditional medicines. We also manage pharmacovigilance by monitoring the safety of medicine and reporting of adverse drug reaction. As pharmacists, also involved in administrative roles in the Ministry of Health and also at the state level, health department. As I said before, I work at Kuala Lumpur health department for 14 years, right? We are actively involved in policy making, strategic planning, auditing and training program. We have to ensure the pharmacy services across the country run smoothly and consistently. In conclusion, pharmacists in the public service are more than just medicine dispenser. We are clinician, educator, regulator, and a policy maker. We have to work together to protect and improve the health of our people and our nation. Okay, that's my scope of work, my scope of work in Ministry of Health.
That's really incredible. If I'm not mistaken, you have been in this field since 2001, and it's a very long journey. For the second question, it makes me think, what is it about this tiny amino acids molecule that makes them so essential for human health?
Okay, we have to go to the second question. Right? Sorry. All right. What makes amino acids so essential for human health? Right? Question. So I like to share a topic that is fundamental to our health and well-being, and that is amino acids. So what exactly are amino acids? Okay, the first question, an important question that I have to answer and explain to you. In simple terms, amino acids are the building blocks of protein. It's protein, and as well as we know, protein are absolutely essential for our body for building and repairing tissues, making enzyme, hormone, and even supporting our immune system. Firstly, they are vital for growth and repair, where healing a wound or building muscle, where amino acid help the body recover and grow. Secondly, they play a major role in producing enzyme and hormone, which control many important processes in the body, like digestion, metabolism, and mood regulation. Okay. Amino acid also crucial for the fight of infection and illness. In addition, certain amino acids help produce a neurotransmitter such as serotonin and dopamine, which is important for brain function and emotional balance. Lastly, when needed, amino acid can even act as an energy source, especially during of stress or intense physical activities. There are three main category of amino acids. The first group or the first type is called essential amino acids. These are the amino acids that cannot be produced by our body, so we must get them through the food we eat. There are 9 essential amino acids like histidine, isoleucine, leucine, lysine, phenylalanine, threonine, tryptophan, valine, okay, and so on. So maybe you can check at your chemistry book, right? Okay, the second type of non-essential amino acid. Okay, second type is a non-essential amino acid, right? So they are produced naturally by our body. Okay, even if we don't get them from food, so our body can also produce amino acid. So we call it as non-essential acids. Right? And the third type is called conditionally essential amino acid. These are usually non-essential, but in time of stress, illness, or during childhood, the body might not produce enough, and so we need to get them from our diet as well. So you can say that amino acid are essential for many life processes, from building muscles to balance mood, strengthening immunity, okay, to help us grow. And so without them, our body simply cannot function properly. Right? Thank you.
Thank you very much, Mr. Azaruddin. So, these amino acids ni kira macam very fundamental for us to do our daily processes lah, right?
Yes, correct. Like I said before, our body can also produce amino acid like cortisol from our kidney. Some can produce from our liver and also usually from kidney lah, and the thyroid, in our thyroid system. The amino acid can also produce from that area also.
Okay, that's very interesting. We shall move on to our next question. How does amino acids interact with the body besides related to protein building? Because just now you mentioned immunity. Could you elaborate a little?
Okay. We often hear that amino acid are the building block of protein, right? And today I would like to share something even more important, more fascinating. Amino acid don't just build muscle or repair tissue; they actually do so much more for our body, like I mentioned before. Okay. Firstly, amino acid help in producing neurotransmitter. Okay. They are chemical messenger in our brain that control our mood, sleep, and focus. For example, amino acid of tryptophan helps make serotonin, which keep our mood stable and help us sleep better. Okay. Meanwhile, tyrosine, help produce dopamine and adrenaline, which keep us alert and motivated. Right. Secondly, amino acid play a key role in hormone production. Okay. Hormone like insulin, adrenaline, and even thyroid hormone, like I said before, are made with the help of amino acids. Okay. Without them, our body will be able to regulate important function like metabolism and stress response. Okay. Hormone production. Next, it's also important for our immune system. You ask. Okay. Certain amino acid like glutamine and arginine help our white blood cell function properly. They assist in fighting infections and healing wounds, especially when the body is under stress. Okay. Besides that, some amino acid help in detoxifying harmful substance from our body. For example, methionine help in liver, so it removes toxin and heavy metal from our body. Okay, this help keep our body clean from inside. Right. So amino acid also act as an energy source when our body run low on carbohydrate or fat. In such case, they can convert into fuel to keep us going. So in this situation, amino acid can turn into peptone in kidney to produce for energy, to replace carbohydrate, right? Okay, another amazing function is their role in antioxidant production. Right? One important antioxidant called glutathione. Glutathione is made using the amino acid system. This antioxidant protect our cell from damage and aging. Okay, I will explain further after this. Okay, lastly, amino acid help with the transport or nutrient and oxygen. For instance, histidine help in the promotion of hemoglobin that which carry oxygen in our blood to all parts of the body. So amino acid are not just muscle builder; they are multitasker, helping in our brain, our hormone, our immune system, and even our energy level. Okay, they keep our body balanced, protected, and function in the best way. Okay, right, thank you.
It's honestly so cool to hear how organized and efficient these molecules are. It's like nature's own little task force working behind the scenes to keep everything in check. Because amino acids were produced and being used in various activities. For example, in the muscles, antibody, and also our emotion.
Right. Okay. Betul, Hidana. It's amazing how our body works in all different areas and how the amino acids sort of carry us so that we're able to go about our day like it's normal. I can see that our curious friends look very excited to ask you questions, Mr. Azaruddin. So let's start with Dania. You may ask your question.
Hai Encik Azaruddin. Okay. Soalan saya berkaitan penggunaan amino acid di hospital. So, what role do amino acid play in IV nutrition and patient recovery? Betul ke amino acid digunakan untuk pesakit koma?
Secara umumnya betul, because of like I said before, one of our role in the hospital and also as at a clinical site where we visit patient with doctors and nurses, we have to identify whether patient need those nutrition for survive. So then with the calculation, with the information, we prepare intravenous strips or total parenteral nutrition for the patient. So as I said before, one of the pharmacist's role in the hospital, we prepare or provide intravenous strips and total parenteral nutrition, IV drip, to the patient. Okay. So when a patient is critically ill, undergoing surgery or unable to eat properly, coma, like coma, the body still need essential nutrition or nutrient, especially protein, to heal, recover, and also to maintain vital function. This is where amino acid in IV nutrition come into play. In hospital, we provide amino acid through total parenteral nutrition, or we call it as TPN, a solution that deliver nutrient directly into the bloodstream. This bypass the digestive system entirely, which is crucial for patients who cannot eat or absorb nutrient normally. So what do amino acid actually do in this process? First, amino acid in IV nutrition promote tissue repair and wound healing. After surgery, trauma, or in case of a pressure ulcer, the body use amino acid to rebuild damaged tissue and skin. Secondly, amino acid help in maintaining muscle mass, especially in patients who are bedridden or recovering in the ICU without protein intake. So the body will break down the muscle for energy, and amino acid help prevent this. Thirdly, certain amino acid like glutamine and arginine support the immune system. Okay, they enhance white blood cell activity and improve the body ability to fight infection, which is extremely important in critical ill or post-operative patient. Additionally, amino acid assists in liver function, enzyme production, and nitrogen balance, where they help maintain the body's metabolic stability, especially when a patient is in a catabolic state, where the body is breaking down faster than it's building up. Okay. In essence, amino acid in IV nutrition are more than just a food. They are lifeline. They support healing, immunity, and survival when the body is at its weakest. Right? So amino acids speed up healing, protect the immune system, and prevent muscle breakdown. So all of which are essential for smooth and successfully recover process to bedridden patient or coma patient. Okay, I hope that answered your question.
Thank you very much, Mr. Azaruddin. Was that able to answer your question, Tanya?
Yes.
All right. So next is amino acid. Actually, it's like very fueling lah to our body. It's like petrol lah. In other words, the importance of it is like petrol in cars lah kan. Okay. So moving on to our next question, Nazura. Would you want to share your question with us?
Yes. Hi, Encik Azaruddin. My question is, can amino acid help with wasting diseases or aging-related loss?
Okay, very good question. Okay, let me explain about muscle wasting disease or aging-related muscle loss. It's also known as sarcopenia. Okay, the disease is also known as sarcopenia. So what is the sarcopenia? In simple terms, sarcopenia refers to the loss of muscle mass, strength, and function as we grow older. It usually begins around the age of 40 and progresses more rapidly after the age of 60. It's a natural part of aging, but in some people it happens more severely, leading to weakness, frailty, and even increased risk of fall or fracture. Okay, this condition can also be seen in people who are bedridden, have chronic illness, or suffer from malnutrition. Yeah, it's not just about getting older, it's also about losing the ability to move and live independently. Okay, there are several factors that contribute to muscle wasting, includes hormone changes, lack of physical activities, poor protein intake, and chronic inflammation in the body. Okay. So, how amino acids really start to lose muscle mass and strength? So, this condition can make everyday activity more difficult, from walking to climbing stairs, or even carrying groceries or things. It can also increase the risk of fall and injuries. But the good news is amino acid can play a big role in slowing down these processes. Okay, first, amino acid are the building block of protein. So, and protein is essential for building and maintaining muscles. So, when we consume enough amino acid, especially the essential amino acid like leucine, the body has the material it needs to repair and rebuild muscle tissue that has been broken down aging, illness, or inactivity. So protein synthesis important for older adults whose body become less efficient at building muscle over time. Okay. Secondly, amino acid help prevent further muscle breakdowns. Okay, during illness, stress, or malnutrition, the body start breaking down muscle to use for energy. Like I said before, when to substitute carbohydrate. So our protein or our muscle will turn into backbone to produce energy. So certain amino acid like glutamine and arginine help protect muscle tissue and support the immune system, which is often weaken the older adults. Okay. In addition, amino acid supplement are sometimes included in nutritional therapies, such as oral supplement or intravenous IV nutrition, that I said before, especially for elderly patients or those recovering from surgery. So we can say that amino acid are not just nutrition, not just a nutrient. They are powerful tools in the fight against muscle loss. So with proper intake, combined with regular exercise and a healthy lifestyle, amino acid can help preserve strength, mobility, and independence as we age. Okay.
Wow, amazing. So amino acids, they're actually sort of preserving the strength and life quality lah for diseases like you said, sarcopenia. Am I correct? Sarcopenia?
Yeah.
Yeah.
Mm-hmm.
Wow. Okay. I think this is our next question from Christina. Will you go ahead, Christina?
Now, all of this makes sense. However, Mr. Azaruddin, how are immunotherapies used for neurological treatment for depression or epilepsy?
Okay. Right. So we go further and it's being a very going to the two difficult question. Okay. Okay. Let's we move to the fascinating area of health. The use of amino acid-based therapy in the managing neurological condition. Okay. Ini macam soalan third year medical student, you know. Okay. Right. As I mentioned before, amino acid are not just nutrient for muscle and body repair, but their role in brain function is just as important. So in some cases, life-changing. In some cases, it's life-changing. So how exactly do amino acid help in this condition? Firstly, some amino acid act as precursor to neurotransmitter, which help regulate mood, sleep, and anxiety. Low serotonin level have been linked to depression. So boosting tryptophan intake, okay, either through food or supplement, may help support emotional well-being. So it will also help in depression. Right. So similarly, the amino acid tyrosine help in production of dopamine, norepinephrine. Right. In the case of epilepsy, okay, certain amino acids are being studied for their effect on brain and excitability. For instance, glutamate is an excitatory neurotransmitter, while GABA, we call it as GABA, which is made from the amino acid glutamine, is inhibitory. It means it helps calm the brain. Okay? And imbalance between these two systems can contribute to seizure. So, supporting GABA production through certain amino acid-based approach may help in seizure control. Okay? In fact, some therapies aim to boost GABA level naturally, okay, helping to calm overactive nerve signal in people with epilepsy or anxiety disorder. Actually, GABA produced in the brain. Okay. That said, this therapy are often used alongside conventional medication, not as replacement, and they require proper medical guideline to be safe and effective. So amino acids are powerful tool for the brain by influencing neurotransmitter activity. They play a promising role in managing conditions like depression, anxiety, and even epilepsy. So offering hope for more natural and targeted approach in mental health care. Okay, so like what you say, Sarah, is play a very important role in our health, right?
Thank you very much, Mr. Azaruddin. I think like you said lah, maybe Christina dia bakal-bakal nak jadi doktor kot. Soalan dah third year medical degree. And about the depression and epilepsy, this is good lah because right now with how times are, society kita dah very focused on mental health awareness and things like that, right? Yeah. Okay. I think this is the final question, right, Hidana?
Alright, before we wrap up, saya rasa many students akan berminat untuk menceburi bidang farmasis after hearing Mr. Azaruddin talking about the job scope and the overall function of amino acid. So, for the final questions, what's your advice for students who might want to dive into this field someday?
Okay, actually, it's not about pharmacies per se. It's about healthcare, healthcare provider, healthcare provider such as a healthcare provider. It also involves nurses, doctor, pharmacists, and others, optometrists also. So it's not about the pharmacy industry. It's also we can call it as a healthcare industry, right? To all young heart and a curious mind out there, all of you, right? Who are thinking of stepping into the world of pharmaceutical and healthcare industry. Let me say this. Okay, you are needed and you are choosing a noble and meaningful journey. Okay. Will always need either you choose to become a pharmacist, doctor, nurse, medical researcher, optometrist, nutritionist, okay, or any healthcare or any other healthcare professional. You are stepping into the field that is built on service, compassion, and science, right? Yes, the journey will be tough. Okay, there will be long hour, challenging exam and days. Okay, when you feel like giving up. Okay, but trust me, every ounce of effort you put in it will one day save a life, ease someone pains, and comfort a family. Okay. In pharmacy, especially, you will not only learn about medicines, you will learn how to think critically, make ethical decision, become a voice of trust in our community. So I encourage all of you, okay, be brave, be passionate, and stay committed. Okay, your knowledge, your care, your integrity will make it a real difference. Okay. You are the future of healthcare, and I believe the future is in a good hands. Right? Thank you, and all the best in your journey.
Thank you, Mr. Azaruddin. Those are really some wise words of a man of 14 years in the industry. Once more, we would like to thank you on behalf of the team and behalf of the university for granting us this extraordinary opportunity to learn more about amino acids and even the healthcare industry. I think, Christina, you can take some notes, yeah? Looks like there's some very important information for you. All right, so to our listeners, please hit follow for more biochemical wisdom. And remember, you are literally made of stardust as well as amino acids. Adios, Amino Amigos signing out.